Our organization was founded by Dr. Chuck Dietzen, a pediatric rehabilitation specialist from Indiana, who spent a lot of his early career working in international settings. He had the opportunity to work with Mother Teresa in India and came back really committed to broadening his commitment to eliminating health disparities, and he founded Timmy Global Health. The organization is named after Dr. Chuck's older brother, who died in infancy. And it's a legacy not only to Dr. Chuck's older brother, but also to all the kids and families and people out there who don't have access to the type of quality health care that they need and deserve. Timmy works to responsibly integrate students and volunteers and medical professionals into global health. And we do that because we want to provide quality services to the poorest of the poor in the developing world. It's not enough to just send doctors and students abroad. Timmy wants to send them abroad to support local partner organizations, to build the capacity of those local partner organizations, so that communities and families and people who don't have access to quality healthcare services get what they need. And on the other side, Timmy doesn't want those students to just go abroad. We want those students to make a lifelong commitment to fighting health disparity. We want them to advocate, we want them to fundraise, we want them to serve, and we want them to stay engaged with these issues throughout their personal and professional lives. Because we know that expanding access to health care is not just about sending doctors abroad. It's about sending them abroad to invest in local partner organizations and invest in the capacity of people already on the ground who are working to expand access to health care. And we also know that getting that next generation of healthcare professionals involved in fighting health disparities is not just about sending them abroad. It's about sending them abroad to understand these challenges and making sure they cultivate a lifelong commitment to fighting them. That's what we do at Timmy. One of the things that we're most proud of at Timmy is that we make sustained commitments not only to our partner organizations, but also to our communities. It's not enough just to send doctors and nurses abroad. Timmy sends them abroad in a consistent and sustainable fashion. We're able to treat our patients all the time. We're able to follow up with chronic diseases. We're able to invest in our partner organizations, and that helps to set Timmy apart. We adopt our communities. We collect patient records on our patients, and we help them overcome all the barriers to healthcare access that they face. Sometimes that means seeing a doctor, but many times it means providing the financial, logistical, other support that our patients need to overcome the challenges that they face. One of the things that makes Timmy Global Health effective is the long-term commitments we make not only to our patients but also to our partners. Short-term medical trips are sometimes limited in their ability to treat patients effectively, so Timmy does it a little bit different. We provide our volunteers and our medical teams structure. We make sure that our medical teams return consistently to communities so that we can treat chronic patients, so that we can refer patients to other services when needed. For example, when a patient comes to our clinics and has a healthcare challenge that we can't treat in that clinic, we don't say good luck. Timmy commits to that patient that we'll find them the resources and the partner organizations, the hospitals that they need to overcome that challenge. One of the things that makes this organization so effective is that we understand that our volunteers are just the tip of the iceberg. When our volunteers provide services, we need to follow up those services with investments in partners and the structure that's required for all health systems to function properly. And that's what we do at Timmy. At Timmy, we take evaluating our service provision and our outreach very seriously. We don't want to know that we treated 10,000 patients. We want to know that the 10,000 patients we treated received quality services. We want to know, of those patients, how many that were referred from our clinics actually got the services that they were referred for. We want to know how many of our chronic patients are consistently getting the medicines they need to overcome their conditions. We want to know the percentage of our students that say that Timmy helps them better understand global health challenges. And we want to know exactly what those students do when they leave our programming. At Timmy, we're really committed to making sure that we constantly improve our programming and improve our outreach. When people think about Timmy, they often look at our medical teams and our volunteers because those are the most visible pieces of our service provision. But the truth is that our medical teams are just the tip of the iceberg. Behind those teams, we do a ton to support the needs of patients and communities where we work. If rural patients have needs and need to get to the hospital, we often transport them. We finance public health programs, malnutrition programs. We train community health workers. We donate in-kind goods and medical supplies to our partner organizations on the ground, because we know that our volunteers can only do so much. We need to support their benevolence and their service by strategically investing in all of the things that create barriers to healthcare access. Since 1997, Timmy has treated more than 60,000 patients through our service provision. We've adopted and worked with 38 rural communities in the developing world, and we now have chapters at 45 high schools and colleges across the United States. And we've made huge investments in our partner organizations. We've helped construct part of an Ecuadorian hospital. We helped a medical school in Haiti get its accreditation. We've helped build a medical clinic in Guatemala. And recently, we got some amazing national recognition when we won the Health and Wellness category of the American Giving Awards. We competed against thousands of other nonprofits in the States, and we were able to go on national television on NBC and talk to millions of people about the work we do and the services we provide all over the world. One of the challenges that Timmy has faced over time is that, like all small nonprofits, it took us a while to clearly define what our mission and value added was. At the beginning of the history of the organization, we supported both health and education projects, and we realized over time that our core competency, our value added, was really health. And so we recognized that we couldn't be all things to all people, and we decided to specifically focus our service provision on healthcare projects and healthcare partners that we knew we had the capacity and the resources and the knowledge to support. As Timmy has grown, so have the needs for additional resources to support the patients that we treat around the world. Timmy makes a commitment to every partner organization and every patient we treat. We're not just going to be there short term, we're going to be there for the long term. And so additional resources would allow us to treat more patients with chronic conditions, invest in more patients that need complicated procedures like surgeries and follow-up and laboratory exams. It would allow us to invest in more public health programs like malnutrition programs, public health promoters. It would allow us to invest in innovative technologies that it would improve our diagnostic capability and improve the overall quality service provision that we can provide to patients in really difficult areas. Additional resources would also allow us to engage thousands of more students at high schools and colleges here in the United States, empowering them to understand global health challenges and help us provide quality services to our patients. We know that there's so much passion and energy amongst today's students. We know that they care about global health challenges, and we need to engage them. Additional resources would allow us to do just that. Some of the morbidities that our patients face are not addressed at the most fundamental level. For example, while we've trained community health workers in rural communities, we haven't yet invested in water solutions for those communities. And we know water quality is one of the fundamental challenges that our patients face. And it's one example of what we could do with additional resources. We could invest in water solutions. We could invest in water quality. And we could improve the overall outreach that we provide to our patients in our communities. With our students, we always stress that we want them to stay engaged fighting health disparities long after their time with Timmy has come to a close. Additional resources would allow us to ramp up distributions from our scholarship fund, providing more of our students and alumni with the resources they need to continue fighting health disparities, to continue engaging with those amazing nonprofits that are expanding access to healthcare.